Good day, panel of judges, here at timekeepers, my co-debater and my very authentic audience. My name is I.Ya, and I'm here to support and project the motion about the use of placebo in medicine. Have you ever had slight symptoms? You look up the symptoms on the internet only to realize that it's related to a particular disease. Then, by nursing it in your subconscious and actually believing in it, you start developing actual physical signs of this disease. This is mind over matter, telling you that your mind has actual control over all body conditions. This same mechanism can work in reverse. That is, by merely believing in the positive effect of any substance, you can increase your expectation by the activation of the expectation and reward center in the limbic system, thereby triggering the body's natural healing mechanism. This is where the word placebo comes in. What is a placebo, you may ask? According to the free online medical dictionary by Fraser, a placebo is a substance or a medical procedure that is an inactive lookalike of the actual medicine or medical procedure, and the patient receiving the placebo is not fully aware of it. A positive change in the patient's attitude or symptom after receiving the placebo is known as the placebo effect. In 1955, Henry K. Pitcher, an American anesthetist, was the first to introduce the word placebo. While treating wounded American soldiers during the Second World War, he ran out of pain-killing morphine. Not knowing what else to use, he started infusing the soldiers with saline solution unknown to them. And amazingly, 40% of the soldiers reported that this treatment actually eased their pain. Research has shown that by taking the placebo, it ignites the body to release endorphin. Endorphin has been seen to have structural similarity with morphine and other opiates. I'm here to tell you, and I'm here to support, the use of placebo in medicine because I think it is medically and humanly unethical to take away a patient's expectation and hope for life. A placebo should be made a medical norm because it has a lot of importance in medicine. Research has shown that patients diagnosed with dreaded disease, like 45% of them, they die not from the actual cause of the disease, but from depression, lack of hope, and no expectation from life. A placebo should be made a medical norm for the following reason. Firstly, it is very important in clinical research because the group taking the placebo can be used as a baseline for comparing the effectiveness of the actual treatment being tested. Secondly, the medical world is very dynamic with new ailments with no known cure coming up daily. Rather than leaving the patient with no hope for life, you give them a placebo to trigger the body's natural healing mechanism, knowing fully well that before the advent of conventional medicine, the body has had its own way of healing itself. Furthermore, in the case of hypochondriac and isotonic patients, these are patients that have constant malaise, which is a feeling of unwellness even when they are healthy. It's kind of a psychological disorder anyways. Sometimes this patient can get well by just the mere attention of the doctor. Do you administer to such patient a treatment for a disease that they don't have? No. A placebo will work very well in this case. More so, doctors can come up with wrong diagnosis. Sometimes, anyways. So, if they come up with wrong diagnosis, for example, in the case of idiopathic diseases, these are diseases with no known cause. They can come up with wrong diagnosis in this case. And when they come up with wrong diagnosis, if you give them a placebo, it averts the risk of giving these patients the wrong medication, thereby leading to intoxication and other medical complications. More so, you may argue about the ineffectiveness of the placebo. But I'm here to tell you that a research that was conducted in Birmingham, United Kingdom by a research facility over there to check and test the pain-relieving factor of a placebo by the use of brain scan. The researchers actually used positron emission tomography to monitor the brain. Now when they monitored the brain, after taking the placebo, they discovered an area of the anterior cingulate cortex, which is the area of the brain with a lot of morphine receptors, was activated after taking this placebo. Now, you have 1 year to live, is what doctors will say to you when hope has been lost in conventional medicine. I personally cannot imagine a medical world where hope has been lost, where patients are left to their fate, rather than given some kind of hope and expectations from life. Having this concrete and pedagogical details about placebo in your mind, I hope you agree with me, and I know you agree with me, that the placebo be made a medical norm. Second speaker from Ternopil.
All protocols duly observed. My utmost respect assigned before those to whom it is due, starting from my most highly reserved judges, fellow speakers from other schools, respectable personnel, and of course, my audience. I'm Horbachevsky, and I'm from Ternopil State University. Honored by this opportunity, I stand here in front of you in concordance to the idea that placebo should be made a medical norm. In order for all of us to be on the same page through the course of this discussion, I'd like to respectfully upgrade your understanding of what placebo is. In its simplest terminologies, placebo can be simply said to be sham treatment. It might include the use of the injection or maybe infusion of saline solution, the use of sugar pills, or just a sham surgery. Now, it might interest you to know that given the fact that placebo includes the use of drugs that do not have known pharmaceutical components that are supposed to stimulate well-being, it is interesting patients who undergo placebo actually show a reduce in symptoms in many clinical disorders. Now that is what we call the placebo effect. Most often than not, when medical minds like today come together to talk about placebo, the first thing that those who are against placebo talk about is ethics. They tell you placebo, it's not a medical ethic. It has questionable ethical procedures. The doctor deceives the patients because in most cases the patients do not actually know that they're being induced substances that do not know to have medical pharmaceutical components. That is what they say. They go on and say all of that. But let me remind you, Wednesday, December 22nd, 2010, at exactly 3:25 p.m., a journal published to various medical organizations around the world revealed the awesome findings of researchers from Harvard Medical Universities. These findings were revealed by a team of scientists, including the Associate Professor of Medicine of Harvard University, Professor Ted Kapchuk, and teams from Russia, who proved beyond reasonable doubts that placebo can actually be administered to patients, and the placebo effect, the so-called placebo effect, can actually be experienced without deceiving the patient. Now, in the course of this study, after the results were found out, I'm going to quote to you right now the exact words of Dr. Ted Kapchuk. Now here's what he said, in quote: "All of the patients were made absolutely aware that the drug that is being given to them has no known pharmaceutical component that is intended to cure them." What was the result of this? All the patients that were given these drugs showed 59% better relief in symptoms compared to the normal 35% in everyday placebo. unquote. What do we learn from this? We learn that when you talk about ethics, the practice of placebo in today's world doesn't actually break ethics, because patients who actually know that they're receiving drugs that have no pharmaceutical components even do better. Now let's talk about side effects. Let's come back home a little bit. Stevens-Johnson's syndrome. It's quite popular in the United States. In every year, 1,000 persons die of Stevens-Johnson syndrome. You might wonder, what is this? Stevens-Johnson syndrome is an allergic reaction that is often experienced after the administration of certain medications. It leads to fatal blindness, psychological traumas, physiological traumas, physical burns that start from within, from inside the organs, and burn the patients right out. Unexplainable angina, pain, tremors, physical dizziness, tiredness. All of these are terrible symptoms that are associated with what we know as consecutive medical drugs. Now, all of these are things we don't have to worry about when we administer placebo, because it doesn't have any chemical components. Now, what does this mean again? This goes to show that placebo not only has the propensity to help us heal patients and make them feel better, it also has the ability to make patients have a sense of well-being even after the administration of this drug. Now, it baffles my imagination, if we know this, why the hell are we arguing? Epilepsy, Parkinson's, autism, asthma, gender dysphoric disorder, premenstrual dysphoric disorder. The girls around here can understand what that means. Ejaculatory disorder, erectile dysfunction. Some guys can understand what that means. All of these are ailments that the administration of placebo over research, over a period of decades, has been proven to help to heal without chemical components. And an awesome sense of well-being is felt afterwards by these patients. Ladies and gentlemen, as an aspiring medical personnel, I strongly believe that whatever there is, anything whatsoever that there is, that has the propensity, that has the ability, and that shows possibilities of healing a patient or prolonging their life, should be made a medical norm. Thank you.
Competitors for the quiz, get ready. We are going to just go into the first round of quiz. Please take all the energy you can from